Japan Part 121. Yet the system of private physicians, low standard fee for doctors' visits, and hospital service, patient responsibility for as much as 30% of healthcare provides more frequent doctor visits for all elements of population than the American delivery system. Following heightened attention to the problems of the elderly in the late 1960s, annuity and pension payments began to increase very rapidly. There are more pension plans. There are more major pension plans covering about 90% of the Japanese pensions. Those for former company employees, Kasoi Nankin, and those for unattached independent citizens, Kokunin Nankin, further divided between contributory payments for those young enough to be part of recent payment plans, and non-contributory, those for the very old and infirm people unable to pay their own way. In 1971, 1.2 million former company employees received 176 billion yen, almost $1 billion in pension payments. But by 1976, 2.4 million received 950 billion yen, over $5 billion. For non-contributory national pension, the 165 billion yen, less than $1 billion, paid to 4.4 million people in 1973, increased up to 706 billion yen, almost $4 billion, paid to 5.1 million by 1976. For contributory national payments, it increased from 50 billion yen, less than $300 million, paid to 750,000 people. In 1973 to 563 billion yen, almost $3 billion, paid to 3 million people in 1976. As a whole, the Ministry of Finance has been careful to assure that funds are available in pension funds before rapidly increasing payments. Although political pressures have forced them to increase payments more rapidly than they would prefer, except for the National Payment Scheme, the government ordinarily distributes up to 25% of the government ordinarily contributes up to 25%, but most of the funds come from reserves. Reserves totaled 14 trillion yen, about $18 billion in 1975, and are deposited in the Ministry of Finance for public investment. Aside from health and old age, welfare payments are still minute by American standard. Unemployment insurance is low because of the low unemployment rate. Companies found it cheaper to set aside their own funds and pay for the disguised unemployment when necessary than to support a very large bureaucratic system of unemployment insurance that is then paid out to the workers laid off or fired. Even when workers are unemployed, the length of the time for which they receive unemployment compensation is generally shorter than in Western countries. By law, all workers under 30 and all workers with less than 1 year of employment cannot receive more than 90 days of unemployment insurance payments, and ordinarily they receive considerably less. Japan has fewer categories of aid programs than the United States. It has general program of livelihood protection subsidies, Shikatsu Hogo, that covers a range of expenses from enough food to avoid starvation to medical aid to cover the 30% of the private expenses that individual citizens cannot afford, to miscellaneous costs such as the modest compulsory education fees.